Welcome to Voices of Change, a podcast for the Get the Medications Right Institute. We are on the cusp of a new era of specialty medications and gene therapies that will transform care. But we are also seeing tremendous waste. Annually, over $528 billion is wasted, and 275,000 lives are lost due to non-optimized medication use. Misuse, overuse, or underuse of medication therapy can lead to treatment failure, a new medical problem, or both. Consider some of these statistics. 1 in 10 Americans take 5 or more prescription drugs. More than 75% of all physician office visits result in a prescription for medication. Annually, more than 4 billion prescriptions are filled in U.S. pharmacies. 50 to 75% of patients do not take their medications as directed. But there is good news. There are opportunities to control the loss and the waste, whether you are involved in receiving, paying for, or delivering care. Living in a world where patients get the right medications the first time is attainable. That's what we're doing at the Get the Medications Right Institute. In this episode, we speak to Carla Cobb, a psychiatric clinical pharmacist with over 20 years of experience integrating clinical pharmacy services into the primary care setting. As a clinical professor, she educated hundreds of pharmacy students and medical residents about the appropriate use of medications to treat chronic conditions such as diabetes, respiratory and cardiovascular diseases, and psychiatric diseases. She's an experienced clinician and educator who has gained the trust of physicians, administrators, payers, and legislators by advocating for the role of clinical pharmacists as part of the team approach to care. She is an authority on the clinical use of medications, the structure and function of healthcare teams, and the compassionate care of people with mental illness and substance abuse disorders. She joins us to talk about all this and more. And that's what you'll hear about on Voices of Change. Here's your host, the Executive Director and co-founder of the Institute, Katie Capps.
Hello, everyone, and thank you for joining us today. Joining me on this episode of Voices of Change is longtime medication management reform leader, Carla Cobb. Dr. Cobb received her Doctor of Pharmacy degree from the University of Texas Health Science Center in San Antonio and completed a residency in psychiatric pharmacy. She is board-certified psychiatric pharmacist. She's a founding member and past president of the College of Psychiatric and Neurologic Pharmacists, or CPNP, and she currently serves as past chair of the Government Affairs and Professional Affairs Committee. We're delighted that CPNP is a Gtmrx strategic partner. Dr. Cobb is also a past board member of the CPNP Foundation and serves as an ad hoc member of the Montana Pharmacy Association Legislative Committee. Her practice and research is focused on the team approach to care for people with psychiatric disorders in the primary care setting. Specifically, pharmacists provided comprehensive medication management for people with psychiatric disorders. In 2017, she was named Pharmacist of the Year for her efforts to secure payment for patient care services provided by clinical pharmacist practitioners in Montana. She currently provides coaching for health systems integrating clinical pharmacy and behavioral health services into a team approach to care. She provides training on psychiatric pharmacotherapy in the primary care setting. Welcome to our show today, Carla.
Thank you, Katie. Thank you for having me.
We're delighted that you can speak with us today. It's been a while since our 2016 national market scan, at which time you were featured, and you were at that time with Riverstone Health Clinic. You were instrumental at Riverstone Health Clinic in establishing a comprehensive medication management program. Now, just as a little bit of background for our listeners, the report that resulted from that 2016 market scan led to the development of the Get the Medications Right Institute. And the report focused on expert comprehensive medication management programs and the results or outcomes from those programs.
The report mentioned here was created by Health2 Resources and Bluethorn Inc. The document, Get the Medications Right, a nationwide snapshot of expert practices, comprehensive medication management in ambulatory and community pharmacy, explores the role of the clinical pharmacist and CMM practices in the community setting. It can be found on the Gtmrx Institute website at gtmr.org. Now, back to Katie and Carla.
Now, Carla, why did you move forward with a comprehensive approach to medication management as part of your work at Riverstone Health Clinic?
Yes, so thanks, Katie. I think one of the main reasons was the work that was being done by the Primary Care Collaborative at the time. Our clinic was working towards recognition as a patient-centered medical home, and in the process, we learned about PCC and the CMM guidelines that they had developed. And it really was something that just made sense to me when I learned about it, and to this day continues to just make sense to me. I think it's a very helpful, CMM is a very helpful framework. It's very organized, very stepwise. It helps us to collect and organize all of the information that we need, and sometimes a lot of complex information that we get from multiple sources, including the patient. But somehow we have to organize it all in order to identify and resolve a patient's drug therapy problems. So this process makes it very, very organized way to do that. And then I think the other thing about CMM is it's a process that is really unique to pharmacists, the education, training, and skill set that we have. In our clinic, it was really helpful to have the CMM guidelines to be able to explain to physicians and other members of the team exactly what it is that the pharmacist did. That was sometimes one of the most common questions is like, what do you do? And what do we do with you? And so when you can show them the guidelines or the 10 steps of CMM, it really makes sense to them and helps delineate the roles of each member of the team in a very purposeful way. And so I found that having that CMM guidelines was really helpful for doing that.
As Carla mentioned, CMM is a 10-step process where physicians and pharmacists ensure that all medications, whether they're prescription, non-prescription, alternative, traditional, vitamins, or nutritional supplements, are individually assessed to determine that each medication is appropriate for the patient, effective for the medical condition, safe given the comorbidities and other medications being taken, and able to be taken by the patient as intended. Importantly, it is a reiterative process. Now, back to the show.
And then lastly, in our clinic, we saw a large number of patients who had either mental illnesses or substance use disorders. And we found that their care tended to be really fragmented. It was a need in our community that often patients saw providers in different settings. They may have a psychiatrist in a different practice. They may be transitioning out of inpatient stays for mental health or substance use disorders. And they really needed help managing their medications, both for their mental health and other medical conditions. And so having a psychiatric pharmacist on the team when I was there at the time and working closely with behavioral health providers on the team, along with their primary care provider, really helped having those different skill sets and the combination of pharmacy, behavioral health, medical care really was an important service that we could offer to the community, and it was much needed in our community. But having that comprehensive medication management performed by a pharmacist, and in my case, a psychiatric pharmacist, really was helpful in establishing and providing those services to that patient population.
Yeah, thanks, Carla. And of course, you know that we are strong believers at the Get the Medications Right Institute and the value that a clinical pharmacist can bring to the team at the primary care level. In order to offer a little bit of context, now I know you're no longer at Riverstone Health Clinic, but in order to offer a little bit of context, can you describe Riverstone Health Clinic in terms of the setting and the clinicians that were involved and the patients?
Yes, so that's a great question that I should have clarified at the beginning, but Riverstone Health is in Billings, Montana, and is a federally qualified health center or community health center. And so it's a primary care practice. At the time, and still, they also have the Montana Family Medicine Residency. So it's a training program to prepare primary care physicians for practice. But what we found is that there was a high need for mental health care in that patient population. So yeah, that was a place that could serve as a medical home, and thus pursuing the patient-centered medical home recognition was an important service that we could provide to the patient to provide whole patient care to that
Yeah.
patient population.
So for those of our listeners that may not be aware, the early work done by the Patient-Centered Primary Care Collaborative, and to Carla's point, the work that came out of the 10 steps toward a more rational and systematic approach to medication use is a way to integrate comprehensive medication management into primary care. And I think that early work is important to informing the work that we're doing now, and certainly the use cases that we're creating within the Institute. So thanks, Carla, for that background. As we move forward, and as primary care looks at integrating services around behavioral health and more appropriate use of medications, certainly the blending of those models makes an awful lot of sense. And you were one of the early adopters in that area, so you were to be commended for that. Thus, you were covered in that early on report that was sponsored by the Community Pharmacy Foundation back in 2016. So now, Carla, let's move on to what you're doing now. And how is that advancing comprehensive medication management and practice?
Yeah, so I left my clinical practice at Riverstone Health about 3 years ago now and founded Capita Consulting. And the purpose of that consulting firm is really to help other practices integrate pharmacists and also other behavioral health providers onto teams. So I spend my time teaching about comprehensive medication management, about role delineation, where pharmacists and other members of the team fit onto that team, and then sharing with others really what took us years to learn at Riverstone Health of how to organize this and how to make it efficient so that there wasn't overlap in the jobs that we were doing, and that we were all doing what we were trained and skilled at doing to the best of our ability, and really sharing the care of the patient as a team. And then I also spend a lot of my time advocating for the role or the value of pharmacists on the team through both the Montana Pharmacy Association and then, of course, with CPNP on their professional and government affairs committees.
And talk to us a little bit about CPNP and the role of CPNP in advancing CMM practice. As I mentioned before, we're delighted that they're a strategic partner of the Get the Medications Right Institute. But for our listeners that might not be aware of who they are and what their work and focus has been over the years, can you expand on that a bit for us?
Sure. So CPNP, or the College of Psychiatric and Neurologic Pharmacists, is a national pharmacy association that supports psychiatric pharmacists and the work that they do. It's a small organization, but mostly made up of people who practice in mental health and substance use disorder practices. Most members provide direct patient care. And as far as CPNP, they have chosen to recognize comprehensive medication management and adopt it as their preferred process of care that psychiatric pharmacists use when providing direct patient care. And it's really been included in pretty much all of the efforts of CPNP. It's incorporated, so CMM is incorporated into position papers, issue briefs. We have a number of issue briefs on our advocacy page on the website. And in fact, we recently published an issue brief specifically about comprehensive medication management and how it differs from medication therapy management. We include it in all of our communications with any letters we write to legislators, payers, meetings with government agencies. We recently completed a number of Hill visits to Capitol Hill and incorporated comprehensive medication management into all of our education of legislators and staffers. And lastly, we are also doing some best practices research, developing a best practice model for psychiatric pharmacists who practice in outpatient settings, and have a number of tenets that are important to that practice role, and comprehensive medication management has also been included there. So it's something that we have taken seriously and taken on.
Well, there's definitely like-mindedness, and we're delighted that the organization is part of the Institute. For those of our listeners that are not familiar with CPNP, I would encourage you to visit their website. There's a wealth of resources available, as Carla mentioned. Now, Carla, as you know, CMM is not the same as disease state medication therapy management. How and why do you think that applying these services in the behavioral health area benefits your patients?
Thanks, Katie. I think that's a really important question. We know that people with mental health and substance use disorders have higher rates of morbidity and mortality compared to those without those disorders. And often that's related to other medical conditions. So for us, it's very important to address not only their mental health, but also their other medical conditions, because there's often an overlap. You can't manage one condition without knowing what their other conditions are or what other medications may be affecting it. One of the best examples that I can give to show the importance of doing whole person care is an example of diabetes. We know that people with mental illnesses often take psychiatric medications, which can either cause diabetes or exacerbate it. And if you try to only manage one of those conditions in isolation, it just wouldn't be effective. And the same goes for an example of people who are on lithium. If somebody is on lithium for bipolar disorder, but you're not aware of their renal status, or if they're on other medications that could affect the lithium level, it really affects the safety of that medication and puts them at risk for toxicity. So it's really important that we're addressing all conditions and all medications in people with mental illnesses for some of these reasons. There are some other factors that I think are important when we're talking about people with mental health and substance use disorders. We know that for people with mental illnesses, some of those illnesses lead to lower adherence rates for medications for a number of reasons. They just may not be able to take their medications as indicated. It may be due to cognitive impairment related to their psychiatric disorder. They may have adverse effects from the medications. And then we also like to take into account a lot of the social determinants of health, which can impact medication adherence. Lack of insurance may not allow them to be able to access their medications like they would want to. Lack of social support can decrease adherence. And things like lack of transportation, that they can't get to a clinic to have a lithium level drawn, for example, is really important. All of these things are important to take into consideration. And I think especially in people with mental health or substance use disorders, there are additional challenges that can lead to drug therapy problems that we really need to identify and resolve to make sure that they're able to meet their goals of therapy.
Yeah, and Carla, I want to applaud you and your leadership role at CPNP and the organization more broadly for recognizing, as we look at integrating behavioral health services into primary care, it's also important to look at integration of the management of the medication needs of those individuals in a holistic way. These are good things that are happening. They're just not happening as quickly as we would all like them to happen, I think. So that certainly it supports the whole person approach to care that not only the patient-centered medical home is about, but should be the way forward in value-based care. So thank you for that response. In a survey that the Institute did earlier this year, and I'm changing the subject a bit because I think it's important to have you weigh in on this particular topic, but we found that nearly 84% of respondents in that survey believe that wide adoption of comprehensive medication management, which is, as you said, is a more rational approach to medication use or a stepwise approach to medication use, it would help stem the opioid addiction crisis. In what ways do you see that systematic and more rational approach impacting the opioid crisis?
The survey pointed out here was released in May of 2020 and polled over 300 healthcare leaders on the biggest issues facing the industry. You can see the rest of the findings on our website under press releases.
Yeah, so that's a great point, Katie. And and I just want to go back to your comment earlier about integrating behavioral health care and substance use disorder care into the primary care setting. We know that most people get their mental health care from a primary care physician. Most antidepressants are prescribed by primary care physicians. So I think it's important for us all to realize that that integration and the move to integrate behavioral health care into the primary care setting is an excellent opportunity for all pharmacists, not just psychiatric pharmacists, to be part of that process in helping people with mental illnesses reach their goals of therapy, whether it's for their mental health or substance use disorder or other medical conditions. So back to the point about the opioid crisis is it's very important. SAMHSA did a recent survey, and they do a survey every year, but the most recent research reported that almost 10 million people have both substance use disorder and a mental illness. And for best outcomes, and as we've already established, that it's really important to treat the whole patient and to treat all of their conditions, not just single out their substance use disorder. So you've really got to look at everything. And what we found is that at least half of those people with both a substance use disorder and a mental illness don't receive treatment for either one. And that, in fact, only 8% or so of people receive treatment for both. So we've got a long way to go in making sure that these people get the treatment that they need. And so I think it's an opportunity for pharmacists to be part of the solution in providing CMM and making sure that these patients get the treatment for all of their conditions that they need. And I think the other thing that's important, again, around treating the whole patient is that a lot of times there are contributing factors that underlie their substance use disorders, things like mental health or underlying pain conditions or trauma that they may have experienced in their earlier years. All of these things can contribute to leading people down the path of using substances, using opioids, and really putting them at risk for serious outcomes and even death from overdose in this population. So again, we really need to treat the whole patient and all of their conditions. The other thing that I was just going to mention is, that we've been talking a lot about the opioid crisis. We've seen an increase in opioid-related deaths and overdose deaths with the pandemic, but we also can't forget about alcohol use disorders and tobacco use, which are even more common than opioid use disorders and also lead to high rates of morbidity and mortality. And again, I think pharmacists can be very important in helping to address all of these substance use disorders as part of the process of comprehensive medication management and taking care of patients.
Absolutely. And to your point earlier, in terms of that 10-step process, I mean, one of the areas of evaluation that a clinical pharmacist is involved with when they're working in collaborative practice with the physician is determining those patients that have not reached the goals of therapy and really understanding the barriers to that. And some of those substances can be the reason for those barriers to that. So I think those are important points to make. Can you explain to our audience, Carla, what candidates would benefit most within the behavioral health setting in primary care in an integrated model from more comprehensive medication management services?
Yeah, so as I mentioned earlier, CPNP has a CMM issue brief that talks about some of these things. I think it's similar to any other population who would benefit that we talk about with CMM, people who are taking complex medication regimens, people with multiple chronic conditions, as you said, people who are not meeting goals of treatment. In mental health, we see a lot of people who have serious adverse effects from their psychiatric medications. So that's a little bit unique here. But of course, many medications cause adverse effects that we need to be aware of and work with patients to resolve those. And then, of course, transitions of care between settings. So for people coming out of a inpatient stay for mental health disorder or substance use disorder treatment, those are people who really can benefit from comprehensive medication management. But then specifically for people with mental illnesses, I think there are a number of situations that is unique to this patient population where CMM can be really beneficial. One is for people who are on high-risk medications, like clozapine, for example, or people taking who are on long-acting injectable antipsychotics. Those are populations that would benefit from CMM due to the high risk side effects of their medications. We also talk a lot about children who are taking antipsychotics and managing those, and especially determining if they're appropriate, and then managing the adverse effects and long-term adverse effects of those medications. And then, of course, as we talked about before, people with substance use disorders can benefit. One of the things we found in our work in providing comprehensive medication management for people with mental health disorders that's a little bit unique to this population is that we found that there were a number of people who were taking unnecessary medications. I think what we sometimes see in this population is that they get started on one medication and then maybe don't have a full response to that treatment. And so the tendency is to add on another medication and never take anything away. And so we see medications added on, added on, added on. And so in this population, deprescribing is something that we talk a lot about that might be more helpful than anything to remove unnecessary medications or medications that have not been effective. And that reduces the pill burden, cost, side effects that are associated, and a lot of times people feel a lot better when you can optimize their medication regimen.
Well, and I think you've made a strong case for the clinical pharmacist role in that patient care process, and in terms of the ability to evaluate that to ensure that medications are being used appropriately, but also, the misuse, overuse, or underuse of drugs, how that evaluation can really impact the quality of life of that individual and the outcomes. So I've got one final question, and I think you've certainly been in this industry and as I mentioned in my opening remarks, a champion of medication management reform for so many years. I think our listeners would be very interested in your point of view, Carla, as it relates to the difference between what we think of as traditional medication therapy management services and comprehensive medication management. That's the first part of the question. And then the second part of the question is the importance of fidelity of practice to ensure that, as you said, there's a comprehensive approach.
Yes, so I'm a firm believer in the value of comprehensive medication management. I think some of the main points as far as fidelity to the model is focusing on treatment goals, that focusing on the whole patient and all of their medications. And that is one thing that really differentiates CMM from MTM. It's not just some arbitrary measure of everyone who's had a heart attack should be on aspirin. There is a place for that for sure, but you can't do that in isolation. You can't really be effective in helping people reach those the treatment goals, without having the clinical data, meeting the patient where they are, understanding their perspective on their medications and helping them to understand the importance of each one. I think you just have to work closely with the patient and evaluate everything. So I think that's one thing. I think one of the other things that I think is really important in comprehensive medication management is working in collaboration with the team, being part of the team, so that everybody on the team understands what your role is, that the patient knows, that the physician knows, that you're really integrated into that team, that you have access to the clinical information, as I said. And then I think to be most efficient in reaching those outcomes is that the pharmacist is able to implement that care plan at the point of care, ideally. That if the pharmacist has a collaborative practice agreement with the patient's physician, that they can implement those changes at the time that they're identified, that's most helpful to the physician on the team. I think the difference here with CMM versus MTM is that, again, that the patient and the physician knows the pharmacist, understands their role, which is different than if you've got a pharmacist who may work for a plan, is unknown to the patient and provider, sends a fax to the practice, that it's not really very helpful. So I think having that pharmacist really working in collaboration with the team is a very important part of CMM. And then the last thing I was going to mention is the importance of, some people think this may be a small thing, but I think it's really important, is the assessing the patient for medication-related problems in order, so that it's appropriateness, effectiveness, safety, and that adherence is last. And I think there are too many programs that get focused on adherence, but as I said earlier, especially in a patient population with mental health and who may be on a number of unnecessary medications, you really don't want to enforce the importance of adhering to a bad medication regimen. So it's really important to do that stepwise process in order to make sure that they're on the right medications, that they're working well for them, that they can take them without drug interactions and side effects. And then that's when you can help the patient understand the value of each medication and the importance of taking them as indicated. And so I think those would be my top 3 important features of CMM, that the importance of fidelity to the model. But I just want to add one more thing. I just can't emphasize enough, in my mind, the value of having a practice, the process of CMM, that you can describe. It's written down on paper. You can explain to other people, and I always say buyers of the program, that whether that is patients who use the service, whether it's physicians who may refer to a pharmacist for that service, or whether it's legislators that we are trying to convince about the unique value that pharmacists bring to the team, or payers who actually pay for the service. I think that if it's really important that all pharmacists get onto the same page of using a process that we all are consistent with and that we can sell to others, that will help us get a long way in making sure that the patients who need this service have access to it.
Thank you, Carla. And thank you for pointing out to our listeners that it's so important to go beyond adherence, because we recognize that adherence is only a small part of the medication therapy problems out there, and the real value and importance of taking those steps in a deliberate way, not jumping to adherence immediately. So I think that's a very good point. So Carla, to follow up on your point, we recognize, particularly in a value-based purchasing world, that we can't expect to be paid for services that can't be measured and or evaluated. How does that relate to the work that you are doing?
So I think one of the things that psychiatric pharmacists in particular, but really all pharmacists can do, is look at measurement-based care. And I think that's something that needs to be talked about, that in order to help patients reach goals of therapy, that we have to look at clinical data. And we talk about that as an important part of fidelity to the model, is you have to have access to that clinical data. You have to assess labs and other measurements. But I think specifically for people with mental illnesses, we have a great opportunity as psychiatric pharmacists in particular to look at measurement-based care using rating scales. And that is something that I think is often missing in clinical practice, is how do we assess response to treatment with psychiatric medications? And really the only way to do that, other than using lab work to assess adverse effects of the medications, is to use rating scales, things like the PHQ-9 or the GAD-7, used to assess response to treatment for depression and generalized anxiety, respectively. That these are really important in assessing response to treatment and ensuring that we optimize the medications and not just put them on an antidepressant and hope they do better, but really to look at, are they getting the full response that they need? And this is an important role that I think psychiatric pharmacists can play in the process of CMM.
Well, thank you again, Carla, for taking the time to speak with us today and offering your insights and perspective. I'd also like to thank you for being a longtime champion of medication management reform, recognizing the important role of the clinical pharmacist in team-based care. Thank you for supporting the important work of the Get the Medications Right Institute as well.
That marks the end of this episode of Voices of Change. Thanks to our listeners for tuning in. For those of you that would like to learn more about Carla's work and the work of CPNP, you will find that information on their website, cpnp.org. CPNP is a strategic partner of the Gtmrx Institute, and their support is critical to the work we do. Gtmrx relies on financial support from those who share our mission and vision. We would like to thank the organizations who have already pledged their support to our work. These organizations include our founding funders, the American Society of Health System Pharmacists, Johnson & Johnson, and the American College of Clinical Pharmacy. Our executive members, California Chronic Care Coalition, Kaiser Permanente, Tabula Rasa Healthcare, and the Department of Veterans Affairs. And our strategic partners, AbbVie, the American Association of Colleges of Pharmacy, Amgen, Association for Accessible Medicines, Avera, Breast Cancer Index, Cleveland Clinic, Coalition of State Rheumatology Organizations, the College of Psychiatric and Neurologic Pharmacists, Curator, Gtmrx, Genentech, Genomind, the Journal of Precision Medicine, Kimber Booth, LabCorp, the National Alliance of Healthcare Purchaser Coalitions, OneOhm, the Partners in Care Foundation, FactMI, and the Teachers Retirement System of Kentucky. Their support is essential to advancing CMM. To learn more about the work of the Gtmrx Institute, please visit us at www.gtmr.org and make sure to follow us on LinkedIn, Twitter, and Facebook. Until next time, be well.